Our eyes are very complex. 24 hours a day, the eye produces a fluid called aqueous to keep itself inflated. This aqueous fluid flows from the back of the eye to the front of the eye. In the front of the eye, the aqueous fluid is filtered out and reabsorbed into the blood. To get to the front of the eye, the aqueous fluid needs to flow around your lens and iris. In some patients, this space can become very narrow and cramped as the iris pushes forward. This forward movement of the iris can block the aqueous fluid from being able to reach the drain and get out of the eye. If the drain gets blocked, then the fluid keeps building up and the eye pressure rises. Unfortunately, the eye doesn't know to stop making fluid. As this pressure rises, you may develop severe headache, the vision will become blurry or steamy, you may even experience nausea and vomiting. We call this process acute angle closure glaucoma. If left untreated, it can result in permanent loss of vision. Other patients can be asymptomatic. Their drain can slowly close and scar shut, and their eye pressure slowly rises to dangerous levels over years. This is called chronic angle closure glaucoma. If your angles are narrow, or we are concerned that you are predisposed to have your angle close off, then you may benefit from a prophylactic procedure to prevent this from getting worse. Most patients benefit from a laser iridotomy. In this procedure, we numb your eye and you sit in a device similar to how we examine you in the office. I bring a lens close to your eye. I then use laser energy to make a small hole in your iris. The laser doesn't hurt, but you will feel a mild sting. Patients often describe it as being more of a surprise than a pain. The laser hole acts like a short circuit or a pressure valve to prevent your drain from closing off or scarring down. The laser hole is so small you will not be able to see it with the naked eye. This laser will not improve your vision, and in many people it doesn't lower eye pressure. Its sole purpose is to help prevent angle closure and prevent scarring that could lead to high pressures in the future. Overall, this is a very safe procedure. You may notice mild blurring of your vision for several days, and some patients can have mild bleeding associated with this that resolves on its own. If you have narrow angles and cataracts, then we oftentimes can just remove the cataract. Doing cataract surgery both resolves the cataract and also opens up your drain and prevents it from closing. Narrow angles are a physical feature of your body, and these physical features are often inherited in families, just like height or hair color. If you have narrow angles, then it is likely that your blood relatives may as well, in which case they may benefit from an examination by a specialist. Let's figure out how to protect your eyes from increased pressure.